Deputy Lewis. Well, we know even more from yesterday that the beleaguered Besti Cadwallader University Health Board still faces some huge issues. As my colleague Darragh Miller pointed out, a new report only out yesterday from the Bundle Quality, Safety and Experience Committee outlined some enormous risks to patient safety. Oxygen cylinders not connected correctly, resulting in no oxygen to patients. Severe backlogs in neurology and patient pathways not being actioned due to dire staffing levels. 1,133 letters have been identified during the search as being dictated by clinicians and that have not yet been issued, the oldest of which is dated 13th of June 2023. And I dare say some of those letters are intended to us from constituent complaints that we've raised and not received any responses. Most alarmingly, during the search of the office, 100+ radiology reports, internal referrals and histology reports, around 300 collectively, have been identified that have not been reviewed or actioned. This is just simply not acceptable. There is no denying that key public service have worsened over the past years under the leadership of the First Minister, Mark Drakeford, with waiting times in such disarray. Currently, there are 4 times as many Welsh residents waiting more than a year for treatment compared to those in England, and a staggering 40% rise in the number of Welsh patients now seeking treatment in English hospitals. Confidence is at such a low level now as regards our health board. You can see why when patients in Wales are waiting on average 6 weeks longer to receive operations, yet I have got constituents who have been waiting, were waiting 2 years pre-COVID, still waiting for operations now. This exemplifies to me just how slow the Welsh Government has been reacting to the crisis in the Besti Health Board. Specifically, I'm reminded of the Bryn yn Neuadd Hospital in Llanfyfechan, where in February I criticised the Welsh Government's failure to discuss and deal with the backlog of £27.7 million of repairs and 70% of the occupied floor level being recorded as not functionally suitable. This is a hospital treating some of the most vulnerable in society, many with complex health needs. I myself have requested a visit there many times over the last 12 months to no avail. So, you know, I can go and visit any hospital anytime, yet I've asked several times to visit the Bryn yn Neuadd. Over the last few years, we've witnessed so many terrible and scandalous reports. 10 reviews have been carried out, all highlighting the significant problems we are hearing yet again this afternoon. It does beggar the belief how much these reviews are costing the taxpayer, and I would be grateful, Minister, if you could confirm today how much taxpayers' money has already been spent on the special measures over the last 12 months. Despite all this investigation inquiry, the Welsh Government seem no closer to understanding the wider issues at play. The most serious in my eyes is the Ernest Young report. The investigation revealed that the finance team intentionally entered inaccurate information into the accounts, falsely attributing expenditures to a single financial year instead of accurately reflecting their distribution over multiple years. I keep being asked by my constituents, Minister, what is happening about that? What is happening about the scandal around the 122 million? This is still not a good time for the Besti Health Board, but I'll reiterate, I'm grateful now of the work being done by Carol Shillabeer, the Chief Exec, David Edwards, and hopefully in time to come, you know, a team, a good working team with a good plan. We are left with record waiting lists and the subsequent consequences on survival rates. Life expectancy in Wales has been declining since 2012, with Wales the third lowest in the UK. We've made calls back in January for the Llandudno Minor Injuries Unit to receive some of the 2.7 million made available. And I really sympathise with Darragh Miller, Gareth Davis, Sam Rowlands, all our North Wales members who raise about the issues with the promises of other minor injury units and emergency departments elsewhere. These smaller hospitals are really, really crucial in battling the pressures that are facing our health board. We, the Welsh Conservatives, are keen to address the underlying issues at play here. Urgent action is needed to finalise substantive appointments to the board to ensure its full capacity. We need a strong leadership. Governance issues have been ongoing in this board since 2012. We need compelling proof that the government and you as the Minister has grasped the necessary lessons, signalling a departure from the pattern of normalised dysfunctionality and decline in standards. Enough is enough. Wales and my constituents and constituents across North Wales deserve better.
Mabara Cwmfor.